You can use a number of neuroimaging techniques to address the question of which brain regions develop during childhood. The first thing to do is define more clearly what is meant by develop. If the interest is in structural changes, then a structural technique, such as MRI, would be suitable. If the interest is in functional changes, then fMRI, MEG, EEG, or indeed optical imaging would be suitable. The choice of technique depends in part on the age range that you're looking at. Some techniques are more comfortable than others, and some are more suitable in young children especially. You would also have to consider the artifacts that may arise because children may move around a lot. To address develop in terms of become better, you would have to combine neuroimaging techniques with some kind of performance measure. And then the second part of the question is more problematic. So the question of which of these brain regions that were identified as developing are crucial for empathy, no neuroimaging technique can address that question. Neuroimaging techniques are always correlational in nature, and they cannot make statements about a particular brain region being causally related to a cognitive function such as empathy. To address that, you would need to do TMS, maybe psychopharmacology manipulations, work with patients, or indeed rely on animal work. To look at the issue of empathy, you would need to design some kind of task that taps into empathy, which is not easy and crucially dependent on how empathy is defined. But that would be the first step in embarking on any kind of neuroimaging experiment.